Hi, I'm Siggy Tadok. I'm the Director of Integrated Solutions at Sotera Wireless. And Sotera is a company down here in San Diego, and we are changing the way monitoring is done in the hospital. So the way that it works today is you have a nurse that's assigned several patients, and periodically the nurse will go from room to room checking on her patients, measuring their vital signs, and then charting it into the EMR. What we found, though, is that between these nurse visits, the patients can deteriorate, and the nurse won't know. And it's a big problem for the hospitals, and it's a big enough problem to where we've created special areas in the hospital called intensive care units, where the patients are monitored 24 hours a day. But they're hooked up to these big monitors. It's expensive. They can't move from their bed. They're assigned a nurse per patient. That's expensive as well. And so the solution that we have is this mobile vital signs monitor that has the same capability. So it measures your heart rate, oxygen saturation, respiration, blood pressure, skin temperature, with this comfortable thumb wrap and a chest sensor that I'm wearing, and this is the size of the chest sensor. With these two sensors, we can get all these vital signs continuously. There's a wireless radio in this portion of our monitor, and it streams continuously over the hospital's wireless backbone and to our server, and the nurse can see on the central station what her patient is doing or his patient is doing all the time.
So with the system, she can remotely monitor all the patients, like if they are in an IC, for example.
Exactly. And so we have, as you can see, we have multiple tiles. Each tile is a patient, and the nurse can select the patients that she's interested in.
Okay. So on one hand, she gets better information, and on the other hand, she gets more time to give attention to the patients.
Exactly.
So this will change how we work in hospitals.
Exactly.
But you even got to go some step further, I heard. So that's where Dr. Alami is coming in.
Hi, I'm Oliver Lamy. I'm CEO of Vital Medicals, and I'm passionate about improving, leveraging technology to improve patient outcomes and efficiency in healthcare. And I I think Sotera Wireless's solution is great for my practice. Again, I perform a lot of conscious sedation procedures, and it's very common for patients to lose their airway during conscious sedation. And because I'm focusing on the procedure, it takes a while for me to become aware of that. So, I live in the Bay Area near Google, and thought, why not try become a Google Explorer, which I did, to integrate VisiMobile, this wireless system, to Google Glass. So now we've built a full integration, and it's not on right now, but we built a full integration so that while I'm doing my conscious sedation procedures, I have basically these live vital signs on Google Glass, and I can always be aware of any changes that the patients have during the procedure. We've designed it to not only be for the surgeon, but also for the nurse that's pushing the medications. It can also be for the anesthesiologist. And
you've got the signs on it, and also, yes. Because you tried it, the sound.
The sound. We also have heart rate sounds and also the oxygen saturation, so that as the oxygen saturation drops, you hear that Morse code sound, the dropping of the tone.
Yeah, great.
So we think this is great. I think this is going to revolutionize healthcare delivery because it's hands-free. It's great for sterile environments. I can multitask. I can get notifications if I have a page. or if I want to communicate with someone, I can communicate with someone. So
this is really disrupting the way
I think this is only the very tip of the iceberg, and also we met the Google Glass Optics engineer, Bernard Kress. He's worked with Google to design this, and this is 10-year-old technology. He says just in a year, this is, their goal is to take this cube and to integrate the prism into the lens of glass. So this is just the very, very beginning that we're seeing.
Well, thank you for coming here and telling us this.
No problem.
I think it's really special, and we will really try to find out a way to do some research on it, even together.
We would love to. We'd love to. Thank you very much.
Okay. Thank you.
Appreciate it.
Ja, ik zit jou deze.